Hi, my name is Joanne Stone, and I am the Director of Maternal Fetal Medicine here at the Icahn School of Medicine at Mount Sinai, and thrilled to be here today. So thank you.
Hi, I'm Fernanda Sheridan. I'm one of the co-directors for Medical Advancement and Innovation at PUSH for Empowered Pregnancy, and happy to be here with you guys.
I'm Marny Smith. I'm a lost mom, and I'm also part of PUSH for Empowered Pregnancy.
It's a day to bring awareness and honor our babies gone too soon. I like to say that everybody can sympathize with a family that lost a child. It's easy to feel their pain, but I don't think that the moms that or dads that had an infant loss or pregnancy loss are under the same category. So we need to bring awareness to this problem, to that pain, and educate the community, and also honor our babies that were gone too soon. So we light up a candle at 7 p.m. globally and let it burn for 1 hour until you pass the torch for the next time zone. In this way, you form a 24 hours wave of light. I was 38 weeks pregnant. I felt that my daughter, Natalie, was moving too frantic, too fast. And then the following day, she was not moving much, but I hesitated. I did not ask for help. I thought I was being paranoid. And my friend told me that babes run out of room in the third trimester. I believe in that. That is not true. I went into labor the same day, rushed to the hospital to Mount Sinai. I heard the worst words in my life, that she did not have a heartbeat anymore. You still have to give birth, but she was lifeless. The staff was amazed. They encouraged me to hold my baby, which I'm thankful for. They put a sign on my door so nobody could come and bother me. They also changed me to another floor, so I didn't have to hear babies crying that would trigger my pain even more. And we don't want any other mom to go through that. PUSH for Empowered Pregnancy is a non-profit organization. We started with 10 families, and now we are more than 6 families that experience a loss. We're all volunteers, and we are dedicated to decrease stillbirth in the United States. We learn from other countries that it's possible, so we are bringing that knowledge to here, and also bringing some tools for the medical community and for the moms. So we act in 2 fronts, partnering up with the medical community so they know that there is a problem that we need to tackle, and showing the tools for that, showing that initiatives were successful in other developed countries. And also we wanna teach the expectant population and help them with tools that we wish we knew when we were pregnant, like know your normal, get to know your baby. Your baby's movements matter. The baby's movements is the only way that he has to communicate with you. So if there's any change, go ask your doctor. He wants to hear from you, and you need to advocate for yourself. So you need to form a team to prevent things to happen. Now, stillbirth is a silent crisis. I went from not knowing that existed to knowing that there are 23,000 a year in the United States. And to put in perspective, that means 3 kindergarten classes dying every single day. That's a lot of children. It's more than seeds, flu, poison, car accident, fire, prematurity, guns, all combined. So stillbirth claims more children's life than all of those combined. So that's a lot. And I think we can decrease that by 25%.
So there are a variety of different factors, some that we know are risk factors, and then some that we go unexplained. But the ones that we know that are risk factors are things like maternal diabetes or chronic hypertension, obesity, the race of the mom. So Black women are at a higher risk. Genetic diseases, genetic abnormalities, birth defects, heart defects, infection. These are all risks for stillbirth. And as Fernanda mentioned, one of the really important things that we can communicate, first of all, is get all the testing and surveillance done. And I forgot to mention fetal growth restriction, which is a really, really important cause of stillbirth as well. But getting all the testing that you can done that's appropriate, and close attention to fetal movement and antepartum surveillance. So in those patients that are at risk, like somebody who is older age or obese or has diabetes or hypertension, these patients need to get followed much more closely and have the baby monitored much more closely to make sure that the baby is tolerating that in utero environment.
So my son, Heath, was 36 weeks and 6 days on September 21st, 2019, when he was stillborn. I had a very normal, healthy pregnancy, and I was not considered high risk. Before Heath was born, he did exhibit decreased fetal movement, which can be a serious sign that the baby is not doing well. Unfortunately, my OB had not educated me about how important and serious decreased fetal movement can be. In addition, I later learned that he was growth restricted, and because a growth scan is not a standard of care in the 3rd trimester in the US, that wasn't caught. So after Heath died, our OB actually told us there was nothing that could have been done. But that was not something that I was willing to accept, especially after doing a lot of research and learning that 23,000 babies die in the US every year. So at least a quarter of stillbirths are preventable, can be up to 50%. And stillbirth prevention is the core mission for PUSH for Empowered Pregnancy.
So it's a completely different type of pregnancy. So the first thing is to try to figure out, if you can, why that stillbirth existed, because there are certain treatments that we may be able to offer to prevent it. So for example, if somebody has, if the fetus was growth restricted, we would do many more ultrasounds to follow the growth of the baby. Or if there was an underlying condition that caused blood clots to occur within the placenta and placental dysfunction, then treatment like a blood thinner might be helpful. If the underlying cause was a genetic disorder, then genetic testing can be done. Looking for any birth defects, heart defects that might have been the cause, things like that. If in the cases where we are not able to identify the cause, and I think a lot of more frequent visits are incredibly important, both to monitor the fetus as well as the mom's health and well-being, because there's a lot of anxiety that surrounds that next pregnancy. Closer surveillance, and then not going till the end of the going to the due date. I mean, we know even in low-risk women that there's less complications if you deliver by 39 weeks. So that's a really important thing to keep in mind. And as both Fernanda and Marny mentioned, discussing fetal growth and any change in the pattern, of the fetal movement is incredibly important. So a lot of close communication, knowing that the patients may need to come in, every week just to make sure that things are okay. I think there's a lot of, besides all the medical clinical aspects. There's a lot of psychosocial aspects that are important, a lot of hand-holding, and making sure that, that the patient feels very well supported.
After Heath died, my next pregnancy, I decided to seek out an MFM, which is basically an OBGYN for high-risk patients. And the acronym MFM stands for maternal fetal medicine. Dr. Stone was recommended to me by a number of people, including another lost mom that I met. And the quality of care that I received as a high-risk patient of Dr. Stone was very different from my initial pregnancy in a number of ways. There were more precautions that were taken. There was more monitoring, more appointments. And something that I think is really key was the consistency and the continuity. In my pregnancy with Heath, I was bouncing back and forth between my OB's office and an imaging center where I did ultrasounds. I was also, meeting all the other OBs at the practice where my OB was. But when I was at Mount Sinai, my doctor was Dr. Stone, and she was with me from start to finish. I had a highly qualified person monitoring my whole pregnancy. And my daughter, Zosie, is 5 months old now.
Well, again, I think that, identifying the cause and then identifying the proper treatment is very, very important. I think that close monitoring of the baby is very important, of the fetus. Frequent ultrasounds for growth, tests that we have, whether it's a non-stress test where we monitor the baby's heartbeat, or do an ultrasound looking for things like fetal movement and tone, and what we call fetal breathing, which is sort of excursions of the diaphragm, and the fluid volume, and then setting a time that you think delivery is appropriate, because again, for these patients, we wouldn't want to go to the very end of the pregnancy. So identifying what is the right time to deliver, and a lot of that might depend on, again, what the underlying cause is, how the baby's growing, things like that. In addition, I think it's a whole, it takes a whole team to care for these patients, because there are so many factors that are involved that, you don't want to trigger. It's so difficult as it is. You don't want to make it worse. So having the staff be aware of, the patient's history is important, and knowing that you have immediate access. Anything, any question, any concern, that we're here to take care of you and come in and be seen and be monitored. I think those are all important. Exercise, nutritional support, and then psychosocial support from other lost moms, I think, is incredibly helpful. So, there are some bereavement clinics that Sinai has a bereavement clinic. There's a lot of support groups. I mean, PUSH organization for empowered pregnancy is really, really important group that brings people together who have had the same experiences. So I think finding those support groups that are around you in your area, people that that you can talk to, or, and if you need to go and talk to a psychiatrist or psychologist or a therapist or a social worker, something in that field is also very important.
The main way that Mount Sinai's perinatal bereavement program helped me was by connecting myself and my husband to other families who had experienced a stillbirth. Stillbirth is really an isolating experience. And because people don't talk about it, you feel like you're the only people in the world going through it and experiencing it. The support group was 7 other people in addition to my husband and myself. And we are all in touch on a regular basis. And we are all involved in PUSH for empowered pregnancy. There is such a stigma around all kinds of loss, especially when it's babies. No one talks about it, and the silence can be lethal. So when I say people don't talk about it, I mean not just your family, not just your friends, but also many doctors and OBs. And it's not fair to expect families to be able to to protect their children if they don't know that this is a risk that exists. So awareness is really the first step to prevention. And families really deserve to be informed and educated about stillbirths, just like they are about many other risks during pregnancy. And for example, Black women are 2 to 3 times more likely to experience a stillbirth than any other race due to systemic racism. So that's something they need to know. And every parent also needs to know that they and their doctors did everything possible to give their baby the best possible chance at life. Still Counts is a new national awareness campaign. It's launched by PUSH for Empowered Pregnancy. And the aim is really to empower expectant parents with the information and the tools that we as lost parents wish we had been given when our babies were in trouble, and maybe we could have taken action to save them. So #StillCounts was conceived and was implemented by, at PUSH, we're an entirely volunteer group of bereaved parents whose babies died in late pregnancy due to causes that were likely preventable. We launched the campaign on October 1st, which is the first day of Pregnancy and Infant Loss Awareness Month. And we actually did a NYC onesie walk. We volunteered, we pinned 900 onesies to a clothesline representing the 900 stillborn babies that are born in New York City alone every year. And we went from Central Park to City Hall to raise awareness. And another initiative that we're working on is the Rainbow Clinic, which would be the first clinic in the US, which is a care center where lost parents or high-risk patients who are pregnant would go and receive specialized care.